everybody, it is Beth and Rachel from Wellness 360. We are going to work on balance today. All right, so grab a chair for support or to sit in like me. Rachel, our PT of the hour, she's going to be the one that's teaching the exercise, and I am going to be your modifier. So if you need any form of modifications, come to me.
All right, first exercise we're going to start with, it's called hip abduction. It's going to be kicking to the side. So pick one leg to start on. You're going to kick out and back in, out and back in. Beth with the modification.
All right, so with the modification, I actually have this lovely little band here. All right, so what I'm going to do is I'm going to stick this band not as easily as it looks. It's not easy to get on, so you don't have to use a band. It just adds a little more resistance. So I have the band around my thighs, never my knees, and I'm going to open and close. If you don't have a band, they're super cheap. You can get them from Walmart or Amazon. They're less than $10, or you can just use your hands and open against the resistance of your hands.
So as you can see, I switched sides. I did about 10 on the right side. Now I'm doing 10 on my left side or your right side. A way you can modify a standing variation, I have a chair next to me. You can always hold onto the chair, kick straight out and back down. What I need you to remember is this direction of your hip does not have a lot of range of motion. So if you feel like you're starting to do this, you're going way too far. If you can see, mine's coming off probably up to 10, 12 inches. I'm going to switch to the other side. Same thing here.
So I like to call these notebook moments. I'm a big journaler as far as working out. This is a great moment to take and see how many times you can kick out to the side without tapping down between. So maybe you do 2 or 3, maybe you do 4 or 5, but without tapping down in between. And then always notice, do I have a strong grip on that chair? Is it fingertip grip? Is it one finger? Is it no hands? Are you just hovering the chair? And this is how you're going to measure your progress. If you're in a chair, maybe it's how many can I do? What color is the resistance band? And these are really great ways for you to show that these videos are working, that you are becoming more stable, and that your fall risk is decreasing.
All right, we'll try a couple more. Another way to kind of progress this exercise is the band that Beth has on her modified version. You can also add that to a standing version. You can start it with above the knees. As you move the band down, the harder it will be. I do recommend having a chair to start with that. Safety first, as always.
Yeah, it's one thing to lose your balance. It's a whole other thing to lose your balance when your legs are tied together. So please use caution, but it is a wonderful exercise.
All right.
If you're using the band, always be in a seated position when taking it on and off. That's very important.
That's a good tip. Okay, next we're going to do, it's called clock taps. So we have these fun dots here. You can use tape, paper plates, kind of anything on the ground just to give you something to reach towards. I'm going to put these down on the ground. Beth has already done so for herself here. Okay, so what you're going to do is start right in the middle. You're going to take your right leg, tap the dot, come back out, go to the side, come back out, go back. As you can see, I'm doing some weight shifting here. So you do want to kind of offload the standing leg and put your weight onto the moving leg. You can see I put my hands up just to kind of keep my balance. And then Beth will explain the modified version.
So for the modified version, I have some dots right in front of me and some dots out to the side. Now you don't have to go out and purchase dots. You can use some construction paper or Post-it notes or whatever you have. Maybe you notice a fuzz that's on your carpet, but just have something to aim towards. So you can do a couple on one side. I tap forward and then out to the side, and then the other side forward and out to the side, and just alternate between the two. You can do 2 on each side, 1 on each side, or stick all to one side and then all to the other side.
A way to modify the standing version. I still have my chair here. I'm going to move it in front of me. Okay, so what you can do light with your hands, You can do this at your counter, just anything that's more stable. Same thing. Tap each, try and weight shift. Okay, switch sides. Another way to make this more challenging, so what you can do, I'm going to take this chair away, and you can actually spread the dots out. This will make you have to reach a little bit further. Again, make sure you have somebody nearby if this is a new activity for you. We will promote safety till our face is blue. Always safety first.
Especially when you're doing exercises at home. There's so many things you can do at home that are so good for you, but there is a safety concern when you don't have one of us looking at your form. Remember, you can always email us and contact us. If you're local, we definitely do home visits, so we can come to your home and we can go through these exercises with you. Or you can just shoot us an email and ask questions accordingly.
All right, let's try one time through. I'm going to finish up on my left, your right. Okay, we are done with the dots for now. I'm going to pick mine up.
I'm going to keep mine 2 down to the side for our next exercise.
Okay, last one. This is the most challenging. It's going to be single imbalance, which is standing on one leg. Get comfortable with that. I do have my chair here. And you're going to add in head turns. Stay on one leg, head to the left, head to the right, nice and slow. And I'll continue as Beth explains the modified version.
All right, so as we're doing our head turns, I'm actually going to be stepping to the right and turning my head to the right, nice and slow. Remember that these head turns can stimulate vertigo. So I'm going to let Rachel talk a little bit about vertigo. But as you're doing this, it's really important that you go nice and slow so you don't stimulate any kind of dizziness. So I'm stepping to the right, I'm turning to the right, hold for just a moment, and bringing everything back to center. I'm stepping to the left, I'm turning my head to the left, and bringing it back to center. So Rachel is actually a specialist in vertigo, so that's good to know. So I'm going to let her talk for just a second about head turns and vertigo.
So switch legs first and keep doing some of the head turning. I'll explain. Vertigo is an inner ear disorder. As physical therapists, what we can do is evaluate you, and we can also treat you in various different ways. With the head turning, with the inner ear, you're kind of throwing it off balance a little bit. So if you are experiencing some vertigo symptoms, we would prefer you to stop that for now. And if it's something that is easily triggered, feel free to contact us. I would be happy to evaluate and assist you in any way possible. Stick with the single imbalance, and we can kind of go from there.
Great job. We have just a couple more of these. Now, Rachel, I'm going to have you run through some modifications. If a single leg balance does not work for you, there's different ways you can start by placing your feet nice and close together. And I'm going to let Rachel kind of go through those steps. So single leg, if you were like, this is just not working, here's some different ways that you can modify that single leg balance.
So first is a narrow base of support or your feet close together, okay? You'll do it exactly the same way. Have a chair nearby if you need it. And do some of those slow turns. If you feel that this is too easy, you can go in what's called a semi-tandem stance, which is your feet they're still next to each other, but they're shifted, one shifted a little bit back. This is semi-tandem. Again, try with the head turns nice and slow. The next variation is a full tandem stance. So one foot right in front of the other, like you're walking on a tightrope. Again, keep that chair nearby. Do some of those slow head turns.
Now remember, with the ataxia pattern, it is really hard to have a narrow base of stance. We know that. So it's really important you maintain your safety, and we are purposely putting you in these positions to challenge you. If these are too challenging, you can always increase your base of stance. So widen your base of stance and try with just the head turns. Don't ever feel like you have to do it because that's what Beth and Rachel said. No, the wider your base, the less challenging the exercise is. So we want you to be challenged. Please check out our perceived rate of stability chart on our website so you can see the best zone for you to be in when you're doing these balance exercises. All right, let's do one more on each side, nice and slow. And last one. And we are all finished your balance challenge for today. Enjoy your day. Again, this is Beth and Rachel with Wellness 360.
Thank you.